Missing out on something else elusive as hell.
Now I'm back from studying the signals our brains make to manifest intention from oscillating.
Hey, Dan. Howdy.
Dan and Kyle here. How's it going?
Yeah, how's it going,
Yeah.
everybody?
Man, I was just telling Kyle before, like, I just really wish, we could like shake hands like we normally do, or like, just give him a big hug. But unfortunately, we're socially isolated. So we don't have the nice studio either, the nice fancy camera. This is, we're back in the jungle, basically.
One benefit, though, is that it is almost 2 o'clock in the afternoon, and I'm still in sweatpants, and my hair is unkempt.
Kind of hard to get a haircut in this time.
Yeah,
so it's like I see your hair is doing the thing. My hair is getting pretty wild as well.
My hair is doing the thing. Yeah, I haven't had a haircut.
It was a technical term.
I was going to say, why don't you tell me how all this started for you? Where were you? When were you sent home? What was your last rotation?
Is this like, it seems like an interrogation, like kind of like, where were you on the night of the murder? Right. Well, so actually Kyle and I were both doing pediatrics. So that was so we're in the phase of our medical education where we're actually working in the hospital full time. And basically Kyle and I, we were both working at the Children's Hospital or elsewhere at the university that involved working with kids. And for me, I thought that was really fun and really rewarding just because I really like kids. And I really like basically working with them. I also did a lot of adolescent medicine during that time and had some really cool conversations with some teenagers. And I'm sure Kyle has had some great experiences that he'd love to talk to you about as well. But basically, it's supposed to be a 6-week-long rotation, but 3 weeks into it, we were sent home. And the thing is, when we first started our rotation, I'm pretty sure, it grew pretty quickly. When we first started our rotation, I don't think there was any talk that our rotations might be canceled early February. It was really off the radar.
Yeah, things developed pretty quickly. I remember I remember in my internal medicine rotation back in January, we were talking about the COVID crisis in Hunan and them closing down, train stations and the borders and all that. And we thought, wow, it's pretty nuts over there, And never did it cross my mind that any of that could have came over here or affected our medical education or, resulted in so many people losing their jobs, losing their lives. Just all that it's turned into has been way more than we had expected. And going along with that, with our rotations, I mean, things developed very quickly. And I remember at the beginning of, there was word, maybe we have a COVID patient here, they're being tested or whatever, and then receiving an email from the dean, identifying us as essential members of the workforce here. So we're going to continue with our clinical education, and then a couple days later, no longer being essential, and actually you guys are going to be going home. And
right, that was a bit of a roller coaster.
Right, it was. And then the next day, this is only going to be for a couple of weeks, and then the day after that, it's going to be longer, and then the day after that, just wait for our next email. So it's been developing pretty rapidly.
So we were just, as Kyle said, for a time we were considered essential personnel working at the hospital. And, for me, there was that odd balance. We were wondering, okay, are we going to be kicked off? Are we going to be kicked off? And for me, I was kind of thinking on one end, I really want to be able to be here. And especially since there'll likely be a staffing shortage, I want to be able to help how I can. But then on the other hand, concerns that a lot of other people brought up is like, why are we paying, why are we in school and paying to expose ourselves to COVID-19, right? This isn't our job. So I saw both sides of that. And
big shout out to all the clerkship directors and the people running things for getting things like transitioned into a virtual education as best they can. And, we all took our shelf exams last week on time, which is pretty amazing, I think, given the circumstances.
Early, which I was actually a little miffed about.
Yeah, we did. We took it a day early. I was a little bummed about that too, but we all passed. We all passed. and that was good. I think because it's everything's changed to pass fail now. So our school used to have fail, pass, near honors, honors for our clerkships, and now everything's pass fail for the rest of our core clerkship year.
So one thing, just to kind of lighten the mood up a little bit, that I thought of when you mentioned your internal med clerkship. So that was what we had before this one, before we were on pediatrics. So I actually met a patient at the Veterans Hospital, and he was talking to me about COVID-19, and he actually told me the cure to the disease. He was very sure of himself. He said that the cure to coronavirus is stevia. Stevia, that's the cure. And
why?
I didn't realize it would be so simple, but there you have it. It's I think it's a sugar supplement, or like,
is it
substitute?
Like a erythritol or something like that? Some sort of sugar alcohol?
I don't know what the chemical is, but what he said was it's the ultimate cure to coronavirus because it is a powerful antibiotic, and it's also been around for 1,500 years. So I'm sold. I feel like we just, instead of masks, we should just be mass producing stevia.
I feel like, I feel like in terms of organic compounds, cyanide's been around for millions of years.
Yeah, exactly.
I think and I'm sure it could kill some bacteria if it needed to.
Mm-hmm.
What?
I had that conversation in adolescent medicine. There was like a 12 or 13-year-old I was seeing who was extremely depressed and suicidal, but he refused to take any sort of depression medication or anything along those lines. And his reasoning was, I don't want to take anything that isn't natural. So I actually sat down, and very gently, said something very similar to him. I said, there are a lot of natural things that are great, but there are also natural things that aren't so great. Snake venom is natural. So that's I'm glad we have the same. When you said that, I just thought that's literally exactly what I would have said.
Oh, totally.
So,
yeah.
Glad we're on the same page. So anyhow, I guess back to the more serious aspects of it. I guess just going a bit more big picture, I think, before we focus back on our own clerkships and how it's affecting our lives. I read today that apparently at least a few residents, medical residents, have actually died from coronavirus, from COVID-19.
Interesting.
Which is crazy. It's a virus that's disproportionately affecting older people.
Yes.
But especially those with these various comorbidities. But I guess that doesn't mean that you can't have the rare case where it actually does affect someone young.
Yeah. And I'll definitely put out the disclaimer too that these diseases don't have to necessarily have a perfect rhyme or reason for why they, kill particular people.
Overall, just the impact around the world is simply staggering. It's amazing and scary how quickly it spread everywhere, and how just universally we have these shutdowns, and how the systems a government has in place have proven to be so important to how many people get infected. Our country has had one of the worst responses in terms of just being prepared, in terms of what we were able to do versus what we did, in terms of being prepared, in terms of making people socially isolate. And now we have more cases than anywhere else in the world, whereas a lot of other countries have taken much quicker measures to not only prevent the spread of the disease, but also to support people affected by the disease.
So for the rest of medical school, we're supposed to be in the hospitals working with patients, working alongside patient care teams, residents, doctors, nurses, pharmacists, and being a part of that and learning on the job. And now we're at home, basically getting an online education. And I think I have two reactions to that. First, I'm a little disappointed, right? I understand, and I totally agree with what the university's doing. I think I'm a little disappointed because that's what I'm here for. I'm here I want to work with patients. I want to see patients. I want to learn how to do medicine. But then at the same time, I very much like being able to make my own schedule throughout the day. So,
yeah.
I like being home, and I like being able to go for a bike ride, in the middle of the day, maybe do some workout, or be able to just like step 10 feet that way into my kitchen and make a meal, things like that. So there's a bit of a trade-off. I definitely have learned that I like working from home.
Yeah.
I like being home. I wonder how many people are gonna come out of this quarantine and realize that, wow, they've spent so much time away from home and at work, and maybe realize that maybe the way we had it was originally disproportionate, to how things could be. Take some fresh eyes to that.
Right. Yeah. So that, those are all really good points. I really found that it's harder. So when I'm at home, in terms of the studying aspect from it, I find it harder to be motivated to do things, because something that I really loved about this phase of medical school is you get up every morning and you think, wow, I'm going to see people. I'm going to help patients out. I'm going to have some great conversations, right? I'm going to go meet my team, and yeah, it'll be busy. It'll be a long day, but that's something that really got me up in the morning and got me really excited. Now there's much less of that. It's a lot more, I got to get up and, read my textbook or whatever, study, I do Anki, do study flashcards, right? That side of it is very different. But I will say that around the time that we were thinking we might get kicked off, I found myself deep down, kind of feeling really tired, and kind of deep down really hoping that, man, it would be really nice to get just get a couple days just to be able to rest.
A break. Can we get a break, please?
Because the way it goes on our clinicals and med, we don't really get any breaks. We get a 1 week long summer break. Other than that, we're just going through the whole year, and we work weekends too a lot of the time. So it can make you bone tired. So I was actually deep down, part of me was really relieved that, I can spend a little more, I can spend some time at home, I can rest a bit more, right?
I think you speak for a lot of us, Daniel.
The studying part of it, it still takes up some time, but I'm probably I've been spending half as much time. I feel like I have a whole day now, rather than just, a few hours after work that I can have for myself. I feel like a lot of people are going to come out of this realizing that they've been able to spend more time with themselves. They've been able to get to know themselves better, right? Being at home like this can make you a little crazy, but there's also that potential for self-reflection, for growing as a person, finding out what it's like to just maybe sit around and just do nothing for a little bit and just enjoy the moment. I feel like there's that side of it. Obviously, this is a crisis that's really horrific for a lot of people around the world. So I don't want to make light of what's happening, right? I don't want to say I don't want to spin this around and say, this is a good thing. Of course, it's not a good thing. But, even within a bad thing, we can find these opportunities. Even within a crisis, those of us who are privileged enough to have this benefit of being able to stay home and relax without any major worries, we have the potential to really grow from that. Just when I was at college in Houston, I was there during Hurricane Harvey, and it was a horrific time, right? The flooding was terrible. So many people lost their homes, and it was a really sad crisis. But for us in school, something that we got out of it is that we just had this time to just sort of sit and be peaceful and just spend time together. And even though this was a massive tragedy, it is a time that I was really able to grow from.
Yeah, I hear you there. And I hope we can do the same with this time. Really try to learn something from having less to do. Yeah. And maybe carry those lessons into, the time when we transition back into or at least attempt to transition back into what we used to do.
The real world.
Yeah.
Yeah, and who knows when that'll be.
Well, until then.
Times of, these are definitely eye-opening times. And, times that it's really important that we're doing our best to, keep our loved ones safe, keep ourselves safe. A good point a good piece of advice that I heard was, you just want to act like you're infected. No matter where you are or what you're doing, just pretend like you're already infected. And that's just the level of carefulness you want to have around other people, because at the end of the day, like you probably, especially if you're a young, healthy person, you probably don't know if you're infected until maybe a few days in.
Most susceptible to the most severe reactions that this disease can provide. So, we younger folks have the privilege of not getting as sick from this disease, but we practice all of that social distancing and hand hygiene
for people we care about, and also with the empathy and understanding that, okay, even if there's no one around me that's old, there are people there are other people's loved ones, other people, right?
Yeah.
That need to be protected and need to be, helped as best we can. And it feels like nothing, but sometimes, right, this inaction, it is a way of helping. And it's crazy to me that, by staying home and just doing nothing, I might be helping out, patients at the hospital way more than if I had been out there, which is a weird feeling, but
it is.
Reality is weird, right?
It highlights too how interdependent we actually all are,
Mm-hmm.
So
yeah,
we may not all be these islands acting in a vacuum like we like to think sometimes.
Seeing how COVID-19 has affected the whole world, I think it really reemphasizes the point that as humans, it doesn't matter where you are, where you live in the world, what your race or your gender or whatever is, like, we're all pretty much the same. This disease doesn't care, right? It doesn't really care what you look like, or how much money you have, right?
No,
it's just
equal opportunity.
Humans.
Yeah.
That's maybe not the wording.
I think it's important to in this time more than ever, just to consider others, and
right.
And take the opportunity, if you are walking past somebody on the sidewalk and 6 feet apart, to really make sure you give somebody a smile and a hand wave, because
sure, right? I feel like that means so much, especially these days.
It does. I think so, because like you and me, we have homes to stay in, and I'm financially secure, and I'm sure you are too. But the people that we walk by on the streets may not be, and so it's just always important to not assume that everybody else is having it as relatively easy as we are. So yeah,
that's so true. Kyle and I had a test recently, and just the past couple of days, I was really freaking out because I thought I did really badly on the test, and I was really worried. And I really had to sort of sit down, and settle down, and really emphasize to myself, this is nothing, right? Even if you failed that test, this is nothing compared to what so many people are going through. Even if they aren't actually affected by the disease, if they've lost their job and they don't have any way to pay their rent the next month, if they, the stress that comes with that, right? People don't need that in their lives. And I think you make a very good point that we should just do everything, even if it's just a smile, even if it's just a wave hello, just do everything we can to make people feel better.
Yeah, man.
So I guess, so maybe to wrap this up, Kyle, I guess we talked a lot about growth. How do you hope to grow from this? What is one thing you want to do or accomplish, or just even not necessarily accomplish, just see, even a change in perspective? What do you have in mind?
I think one thing particularly for me, is a particular challenge for me, is staying disciplined. So without having really any place to be and things like that, being able to create a routine for myself and to stick to it is something that has been challenging, and I hope to continue to improve on. So just trying to establish a routine and not allow myself to diverge from that, and really allow myself to experience the discomfort of not doing whatever I want to do when I want to do it, So hopefully growing from that too.
Mm-hmm. Yeah, that's a very good point. Yeah, I like the idea of just setting a schedule as if I'm going to work, even though I'm not actually working. That's probably something that I should do. And I definitely hope to come out of this more dependable. I feel like I can depend on myself, right, to do what needs to be done and to be responsible about my work and things I do in my life. I feel like I really want to work on. I feel like in my mind I have this very sharp divide. These are the fun things I want to do, and these are the things and these are the tasks on one end, and on the other hand, I have the tasks that I have to do. And especially when I'm at home and free, it's really hard to, when you have that dichotomy, it's really hard to shift from doing the fun stuff to the boring, or like to what I see as menial, even though it may be stuff that I find rewarding, right? When it comes to like reviewing flashcards for medical school, it's dry material, but it's also really important if you can use it to help someone else. So sort of being able to see that light and being able to get rid of that divide so I can more flexibly, right, kind of do what you said, be more disciplined. And I feel like getting rid of that dichotomy will help me be more disciplined and help me like being able to just do both things and enjoy both things, and not having to spend like study time more thinking about like, oh, I could be playing X video game or watching a TV show or something like that. Just being able to be free of that burden.
Right. It's not a punishment. I'm not depriving myself of anything by stepping away from the video game and doing the study.
I'm giving myself
in any way. But that's how it feels.
Right. I'm giving myself something new.
Yes, exactly.
Once again, amazing talking to you, Big K.
You too, Dan.
Do you have anything else to any quirky comments or something to wrap this up?
You stay classy, San Diego. Yeah.
Brush your teeth, everyone. That's important.
That's
Not forget dental hygiene in these trying times.
No, we still have to brush our teeth in the morning and at night.
I was gonna. All right, wait. Let's give a social isolation high five to finish this off. Boom.
Right on.
That was the best high five.
These are clean hands.
Oh, hey. If you liked our video, please like and subscribe. And if you didn't like our video, dislike and subscribe.
But please, bring some helpful commentary.
Yeah, make sure to comment with your favorite raspberry tart recipe. That would help us out a lot.
That would be very helpful.
We're very hungry.